First up, fillers. In the filler category, you're talking about things that will increase volume. Now, there's three different types in this category. There are hyaluronic acid products. Those are by brand names like Juvederm and Restylane. Then there's calcium hydroxyapatite. Those are things like Radiesse. The third category is biostimulators like Sculptra, and they stimulate collagen. But all three of those are used to basically get in front of the need for a facelift or used to buy some time before you need a facelift. But all three of those can have very negative effects on your facelift when it's performed later on. So how can these directly affect a facelift? Number one, they leave a footprint and a portion of that filler is there forever. The hyaluronic acid fillers, which are supposed to go away in 6 to 12 months, actually don't. Products like Radiesse, they stay in even longer. And then you have products like Sculptra, which build collagen nests throughout the tissue, and they can stay even longer, up to 4 years or plus. In fact, some fillers in studies have been shown, even the hyaluronic acid variety, that have been there 10 years or so after the filler was injected. So what does that mean? Well, number one, it means it starts to change the look of the face. So if the goal and idea is that you're gonna look like you used to, turn back the clock and look like you did when you were in your 30s, well, getting something done along the way that is pulling you further and further away from what you used to look like, because anytime you're adding volume to, say, lift the cheeks or build up the jawline to hide the jowls, those things are areas of volume that your face did not have when you were in your 20s and 30s. They're newly introduced, and over time they start to build up. The cheeks get bigger, the jawline gets broader. Eventually your face doesn't look anything like it did back when it was younger. That's one aspect. It's the deformity that's formed over time. Second aspect of it is that all of these fillers and biostimulators, wherever they're injected, they leave some level of scar tissue. Scar tissue is a byproduct of your body trying to break down hyaluronic acid products like Juvederm and Restylane, because it's, at the end of the day, a foreign body. Same goes for the calcium hydroxyapatite variety, which is Radiesse. Your body sees these things as foreign bodies. So as a result, it wants to break it down. That breakdown process is inflammatory. That inflammatory process leads to scar tissue. That's simply the cycle that happens at the soft tissue level. And that is also true for the hyaluronic acid products as well as Radiesse.